And welcome back to The Factor Uncensored. You absolutely don't need me to tell you this. This last year was hard as hell to cope with. But for 44% of Americans, they say it was the lowest they have ever felt emotionally, ever. So what now? We talked to a therapist about the findings and how you can get help. And joining us now here on The Factor Uncensored is Dr. Bernadette Smith, who is a licensed professional counselor. Dr. Smith, with this study coming out, it shouldn't be a surprise that people have been, a little depressed during the pandemic. But they said for Americans, it was at an all-time low.
Right. Absolutely. Yes. So the study is not necessarily surprising for people who are experiencing the pandemic and therapists alike. But what's really interesting is how much we're seeing this increase in terms of mental health need. Right. So one of the things in the study, it talked about how 42% of the people reported that they have feelings of anxiety. Well, historically, like when you're looking at NAMI, they're kind of saying it was historically 18 to 19% of Americans. So we are seeing this increase. And one of the things that we're seeing is, one, the pandemic kind of forced people to slow down. So some people who try to stay busy to forget about the problems that are going on in their life are now forced to have to sit with those issues that they've been trying to hide.
And actual people, if you don't want to be around them.
Yes, exactly. Actual people as well, right? So there's been some people that I've worked with and they are living in smaller houses with multiple family members in there. And that can be very challenging and very disrupting, not to mention trying to work full time if you're working remotely while taking care of your children, because childcare and schooling look very different. So really experiencing, not to mention if somebody experienced job loss, on top of sickness, people losing loved ones, the uncertainty of the pandemic is creating all of these feelings of anxiety and these feelings of depression for individuals.
In the last minute that we have left, how important is it to get these issues addressed? If you don't feel like you're automatically coming out of it as things open back up, what approach should you take in order to get it addressed or to deal with it?
Yeah, so one of the things, if you're noticing that these issues are impacting you, is to reach out for help. So whether that is talking to a trusted friend or reaching out to that mental health support so that you can work with a therapist to identify what those issues and concerns are to help you reach those therapeutic goals that you have.
And
one of the things.
Go ahead.
Mm-hmm. Go ahead. One of the things in the study that I found interesting is they said it was very challenging for them to identify a counselor that they could feel connected to. Mm-hmm. And so one of the things that you can be mindful of is you can ask a counselor to do a free consultation, which is about a 15-minute call to see if that's a good fit for you before you engage in a therapeutic relationship.
And of course, if you need any help, remember the crisis text line is free. If you ever feel like you need help, just text the word HOME to 741-741. That's the word HOME to 741-741. Free support is available 24/7.